caregiver separated from your loved one, what can you share about that experience for other caregivers?
That was definitely the hardest part, for sure. My dad doesn't live too far away from me, so we see each other pretty regularly. And then, this is the first time in our lifetime that this has been such an issue. My mother had a brain aneurysm and hemorrhagic stroke a couple of years ago. And that was something that was so encouraging is, we could be at her bedside. We could be there every minute, and just be with her. So even if things didn't go our way, we felt like we were able to comfort her or, just make an impact in some way. So with my dad, that was so difficult. You feel very, everything just feels so out of control. He's there alone, with strangers. We hope that all of the staff was good or kind and gentle and talk to him, even though he's, sedated, stuff like that, things that the family really cares about. And you just don't know. And so we were so relieved when we did see him. And then in that setting, like you said, that, we couldn't have asked for any better care from the doctors to nurses to the housekeeping. Everybody was just so kind and loving. And which is, I don't want to say surprising, but I know so many people are very burned out at this point. They've been doing this a long time. They've, surrounded by death. And so for people to still be so compassionate and hopeful and encouraging was really great. One thing that we did do too, I'm hoping that other hospitals are doing it as well. But the Center for Patients and Families was a really great resource for us. They partnered with the chaplain service. So at one point, we were able to FaceTime. You weren't awake, but it at least allowed him to hear my voice or for me to see him or to say, a couple of things, in case we didn't see him again. I made posters with pictures of him and of our family. Some of that was for him, but a lot of it, that was probably the biggest one. One of the nurses called me maybe about a week after he had been there, and it was a perfectly appropriate question, but it hit me just really hard. She asked me if he spoke English, and I realized that nobody knows him. They didn't have an opportunity to talk to him before he was intubated. He just arrived on the floor already intubated. And so you kind of, in my role as a nurse, so much of what I love and what is so important to me is that patient connection, the building the rapport with my patients and getting to know them and finding small ways to make them more comfortable. And it really hurt thinking that I have this, amazing father and they don't know who he is. And I know we treat everyone the same and, but it was important to me that they knew that in some way. So I made this poster that just introduced him. Again, he didn't look like himself. He had this huge full beard. I'm sure Dr. Vazquez remembers. And so I had an older picture of, him like this, clean cut and handsome. And it just said, hi, my name's Kiko Castro or Gonzalo, but everybody calls me Kiko. And it kind of just introduced him a little bit. And then I had pictures of all of us and our family that said, this is my wife. We've been married for almost 40 years. This is my son. And I felt like it humanized him for the staff because I got a lot of feedback about it. I really didn't think it would be as big of a deal, but what they ended up doing, I remember one of the nurses, she said, every day she went in his room, she'd pick something off of the poster to talk to him about, even though he was still sedated. And so she'd come in and she'd say something about the grandkids or, and I think that stuff is so important, or like music or football. Mm-hmm. I remember one of the doctors put on college football games on Saturdays, and that it just meant a lot to us to think that they were still treating him like a person and not not, I'm sorry, I know I'm not being very articulate with that, but it humanized him in a way that I thought was really important.
I actually have a picture of the ICU where he was at.
Mm.
No people. There's no people.
Yep.
Let me try to share my screen, because it's actually important in what Angela was saying as to the isolation of the patient. This is what all the ICUs look like.
Very sterile and very bleak. And, like you're saying, usually all of those doors are open,
Right.
so it's just, there's a lot more life in there. And kind of like I mentioned too, with the posters, once my dad was taken off of the precautions, so it's not quite as bad, but on the other side, where once everybody's off of the respiratory precautions, but it's very similar. I mean, it's the same setup. It's just a different side of that unit. I had more posters. I brought in, I made a little mobile with birds on it and stuff, but I added color to his room. And then in addition, I had I got him a premium Spotify account, which just played round the clock orchestral music or operas, all the stuff that he likes. And I was convinced that once he got over to that side, that the nurses spent more time in his room because it looked cheerier, it looked colorful. It wasn't as depressing as some of the other spaces were. And I don't know if that's true or not, but I think it made a difference for him, and then as well as maybe the staff even.